Hello, my name is Amy Gravitte, and I study chlamydia, which is a common sexually transmitted infection that causes things like painful urination and vaginal discharge. If it's caught early, then chlamydia can be treated with a simple round of antibiotics, and the patient is left with a healthy genital tract like you see in the picture on the left. However, most infections, and that's up to 95%, are asymptomatic. And that means that women infected with chlamydia don't even know it. And that's where chlamydia gets dangerous because it can ascend the genital tract, get up into the uterus and the fallopian tubes and even into the ovaries. And this is represented in the picture on the right. It's in this case that we see things like pelvic inflammatory disease, where we have painful inflammation, things like tubal infertility, ectopic pregnancy, and scarring of the genital tract. This scarring is irreversible. So you can see there are many reasons why we need to study chlamydia and figure out all we can about how to stop its infection. So one thing that's important to consider when we study the female genital tract is the rise and fall of estrogen and progesterone during the menstrual cycle. And these are the primary female sex hormones that we study. But another thing that affects these hormones is the use of hormonal birth control. And this is used by a large portion of the female population. And we know that hormones really affect the immune system, and it raises the question, does the change in hormones due to menstrual cycling or hormonal birth control use affect your probability or your chances of contracting chlamydia? And so in my experiments, I'm studying estrogen signaling and how it affects chlamydial infection in mice. So I've infected two groups of mice with chlamydia. One is an estrogen receptor knockout mouse. This is a mouse that has no estrogen signaling, and I'm calling it an experimental mouse. And I compare it to a normal mouse, which just has normal genetics. So I tested the amount of chlamydia shed by these mice by doing a vaginal swab of the infected mouse and then measuring the amount of chlamydia that came off of that swab. And what I found was that over 21 days, there was no change in infection. But the experimental mice had earlier infection that cleared early, and the normal mice had infection that was midway through the cycle and it took a little longer to clear. So now we wanted to know what caused this difference in timing. So we tested the immune response, and we found that experimental mice had lots more immune cells during early infection, and this probably caused that earlier clearance. But now we need to know why is estrogen signaling changing the immune response to chlamydia? But I'm just going to have to leave you on a cliffhanger because that's where we are in our experiments and we're still trying to figure that out.